Hi, Keith here. People can have some trouble getting their head around type 1 and type 2 errors. What do they actually mean, and what are the practical consequences of making these two types of mistakes? So in this short video tutorial, I'm going to look at these in a bit more detail and explore an example. Here is the table you will have seen in a few locations in the learning materials. In the real world, the null hypothesis must be either true or false. It can't be both. If it's true and we accept it, we've made the correct decision. Likewise, if the null is actually false and we reject it, we've also made the correct decision. But we can make two types of errors. If the null is true, but we reject it, in other words, we reject it when it should be accepted, we've made a type 1 error. The other type of mistake you will know as a type 2 error. This is where the null is false and we should reject it, but we accept it. In all of these cases, we're making a decision based on the results of a statistical test. And much of the time that will cause us to make the correct decision, but occasionally it will cause us to make one of these two types of mistakes. Now let's look at an example to look at the consequences of the two different kinds of errors. I'm going to use a medical example, a situation in which a new disease has been discovered, oral phlebitis. As it happens, the early symptoms of this disease are very similar to those of the common cold. Unfortunately, if the disease progresses, it can have some nasty consequences in that your ears fall off. The condition is easily treated by antibiotics, but it is rare. So the doctors just can't give antibiotics to everyone who comes in with the symptoms of the common cold. They need to do a screening test. Now, suppose we have a large number of patients turning up to the practice. They have the symptoms of the common cold. Some might have oral phlebitis. Because it's rare, only one or two will. So we'll take as our null hypothesis the idea that the patient does not have the disease. And we'll run our blood test and make a decision based on the results of that test. All tests are imperfect. Sometimes they'll come back saying a person has something when they don't, or they don't have it when they do. So let's look at that situation. Let's look at the type 1 error. This is the case where the null is true, the patient does not have phlebitis, but we decide based on the test results that they do. Eventually they're going to get better because they've just got a cold. Unfortunately, however, we're going to give them the antibiotic. They're going to be treated when they shouldn't be, and this could potentially have some significance. It will depend on the side effects of the drug. Conversely, our patient who does have phlebitis and we make a type 2 error, they're not going to be treated, and sadly their ears will fall off. So we've got two different kinds of outcomes here depending on whether we make a type 1 or type 2 error. Whether we make a false positive, where we're going to treat the patient when they shouldn't be, or a false negative, a type 2, when we're not going to pick up the condition, we're not going to treat the patient, and there are going to be unfortunate consequences. Now, the seriousness of these two types of errors depends on the situation. It depends on the consequences of treating versus not treating. And how often we make those two types of mistakes will depend on the information we collect and how reliable the test is. So hopefully that can give you a more concrete way of thinking about these two types of errors. Type 1, rejecting the null when it should be accepted, or type 2, accepting it when it should be rejected. It can often be helpful to think in terms of false positive and false negative, but you always need to go back and look at the null hypothesis to decide what the consequences of the two types of mistakes will be. Thank you. Hopefully that helps.